Good evening, everybody. All right, I'm happy to announce that today we're starting our patient education sessions, and we are just finishing a few little technicalities, and then we will start our presentation. But just to let you know that we'll be doing this on a monthly basis, and for the first Thursday in each month. Okay. Now we weren't able to do any last week because of a little mishap. However, we will continue these sessions for the next 6 months, and so looking forward to see you. Just hold tight. We'll start in a few minutes. We're just getting some short little things out of the way, and you're going to get some high quality um, viewers viewing, and so just bear with us a little bit more. All right. All right, good evening again, everyone. I'm Dane Thomas, and I'm happy to start off our patient education sessions this evening. Um, just to let you know that, again, that we will be doing these presentations once per month, and each month we'll be coming with a different topic, of course, an interesting topic, a topic that will affect you, and a topic that will make you more healthy. Just to let you know also that at Gateway Pharmacy, we care for you, our patients. We care for your, not just for you to just come and fill your prescriptions, but after you leave the pharmacy, what happens next? And that's very important. Just buying your medications is good, but it's more important to take your medications. So these sessions are pointed to making you better patients. And as I always say, educated patients are better patients. So we want to use this time to educate you, to let you understand more about medications, about disease conditions, and the importance of taking the medications. So we start off this evening with weight management. Everybody wants to lose weight. Everybody come to the pharmacy. Then, can I get something to lose weight? You go to any pharmacy, that's one of the main things that persons ask for. Something that would cause them to lose weight. And losing weight is not something that is that easy. It takes time. It is easy to put on weight, but it's hard to lose weight, right? So it will take time. So this evening, we're going to show you some ways in which you can lose weight or, be better managers of your weight. And so we start off this evening talking about that. Now, weight management is what we are focusing on for today. Why weight management is critical. All right. Global studies predict that more than half the population will be overweight in the next 12 years, if not prevented. So that means 1 in every 2 patients will be overweight, okay? Which any one of you will be overweight within the next 12 years if it is not treated and not prevented. The rising prevalence of obesity is expected to be the steepest among children and adolescents, rising from 10% to 20% of the world of the boys and 8% to 18% amongst the girls. So therefore, if you are a parent, best believe that your child, if not controlled properly, will be overweight when they become an adolescent or as the younger children. So it's very important that we understand this. And another thing is the global economic impact. Now, if we spend so much time trying to treat obesity or spend a lot of time trying to treat, overweight, then it will have that global impact because we'll be spending more money trying to control that. Continue. All right. All right. Who's that? No, that is me. That was many years ago. You see my size? Look at my size. This was when I was a lot younger. I was a lot younger at the time, and look at my size. So help. What are the risk factors of being overweight? High blood pressure, high blood sugar, high cholesterol, lack of mobility. So when you're bigger, it's harder for you to move around. You can't run from nobody at all. Lowered self-esteem. I mean, when you're a bit, over there, then it can affect you, mentally, not only physically, but mentally, it can also affect you. And so it's very important that, we try to manage this. Heart disease is another risk factor of being overweight. And so if you are bigger, then the heart will need to pump more blood to circulate the entire body. So which means it will put more pressure on the heart. All right? So therefore, it's very important that we understand this. Sleeping disorder. As you get, if you're bigger, then you will have sleeping disorder. All right? So that has to be controlled. So these are the risk factors that comes with being overweight. There are more, but I just want to highlight these ones now, right? So the high blood pressure, the high blood cholesterol, the high blood sugar, heart disease, lack of mobility, all of these things can affect you once you're overweight. Look at me again. So the first slide showed you when I was a lot bigger, I started to work out, going to the gym, and all of these things. And look at me then. This is when I just came to Mandeville. I'm from Kingston. When I just came to Mandeville, I was working out a lot, and look at me then. I did not take any pills or anything at all like that. All I did, go to the gym twice a day, and look at me then. And I tell you something that my work ethic at the time in the gym inspired my younger brother to become a body lifter. Believe me, he's not gonna admit it, but the truth, I can tell you this. So, what should you do? These are the questions that you will be asking. All right? What should I do? If I'm overweight, or if I know somebody who's overweight, what should I do? What should I do? First, talk to your healthcare provider, whether it be your physician, whether it be your pharmacist, or your nutritionist. You need to speak to these persons. These are the persons that can help you in controlling your weight. Eat a balanced meal. Always eat a balanced meal. What is a balanced meal? Your nutritionist will also advise you. Our presenter coming up will also give you some tidbits about that. But always eat a balanced meal. Set daily eating time. This is very important because the body's metabolic rate changes during the day. So you set, specific eating time, and that will also help you to control your weight. All right? So that's very, very important. Do daily workout. 15 minutes in the morning and 15 minutes in the evening is not bad. That would mean that you have done 30 minutes for the day. And if you multiply that by 5 times 30, that's 150 minutes for the week. So, if you look at it like that, just break it down in terms of your working out. You don't have to say, if you have a busy schedule, right? You can always break it down like this, Let me do 15 minutes in the morning, let me do 15 minutes in the evening, and you can work out. Just do some workout, because for you to lose weight, you also have to do some kind of work. Yeah, you have to do some kind of work. A lot of persons just want to take some pills and make them lose weight. But we're in the age of that, but that alone will not be enough. You have to do at least some kind of working out. You have to do that. Drink more water, less sugary drinks. This is very critical because sugary drinks carry a lot of high carbs, and the body converts high carbs, sugar, to fat. And that's where a lot of us tend to gain weight. So we always drink juice. I am guilty of that also, I must say. I don't drink enough water on a daily basis, but I'm just pointing it out that if you drink more water, less sugary juice, it's better for you. It is more healthy for you, all right? So try to avoid too much sugary drinks. Thank you very much. But before I give a close, I'm not going to close that. But this is my little short section that I'm talking about before my main presenter comes on. And just before she comes on, I'm going to do something really, really quick to just talk about her. I mean, it's my very good friend. I've known her for many, many years. I won't say how long I know her because that will give away her age and also my age. But it's my good friend for many, many years. Um, I'm going to do a really short introduction about her. And but before, what is Ozempic? And this is what we're going to talk about today. Is Ozempic safe for me? Will it help me to lose weight? How long will I need to take it? Can it be used in combination with other drugs? What is the age limitation? And what is the cost? These are the main questions that persons will ask about Ozempic, and these questions will be addressed by my dearest friend. So let me do a quick introduction of my friend. Her name is Dr. Renee Clark. So my friend there, this is my friend, Renee. Renee is owner of Decal Health and Wellness. She specializes in weight loss programs. She also provides hormone pellet therapy for both men and women. And she recently collaborated with dancehall artist Tifa in her drastic weight loss journey. So if you know Tifa was a little bit bigger, but Dr. Clark and her husband, they have collaborated with her in bringing her down, should I say down to size? And she has almost 30 years of dedication to health and wellness. So with that said, there's so much more I can say about Renee, but time wouldn't afford me to say all what I can say, but you can learn more about her still. And I'm going to just open now the floor now to Renee, and Renee will be coming on to talk about Ozempic. She'll be talking about weight management, and she'll be going more details than I just did. But thank you for listening. We continue with Renee and her presentation.
Thank you, Mr. Thomas, and thank you to your team at Gateway Pharmacy. Big up on yourself, on a well lodge. Well, I just want to take this time to just say thank you for coming on tonight. This is a topic that is near and dear to my heart, mainly because I have suffered from obesity and some obesity related condition for as long as I can remember. And many individuals in my family also are enduring this chronic condition. So my duty here tonight, I think, will maybe be a little easy, just to talk a little bit about what it is that you can do as it relates to getting on medication therapy. And there are tons of meds on the market. But in specific tonight, I'm going to talk about the GLP-1 agonists in the form of Ozempic and Wegovy. So we're going to get started with that, okay? And everyone can hear me well and see my screen, I'm hoping. All right. So to medicate or not to medicate? And I know that many persons have their differing opinions because they don't realize that obesity really is a chronic condition. They are consistently thinking that obesity is as a result of the moral decadence in society, or someone is just lazy, or just run a little bit more on the treadmill, add more steps to your day, drink some lemon water. We have heard it all. But clearly, from the statistics given by Mr. Thomas, with more than 50% of the world's population being obese, those things may work for some, but there might need to be adjunct therapy for others. And that is where I come in tonight. Sorry, my computer decides to spin. Okay. So let's talk a little bit about our agenda tonight. We're going to talk about Ozempic, of course. We're going to talk about a nice definition of what obesity is. And Dane has already given you a bit of the statistics. I'll just be brief on that section. We're going to sort of do a comparison between Ozempic and Wegovy, both of which are semaglutide, the molecule, and I want you to remember that. How does this particular class of therapy work? Because there are many drugs in this class of therapy, the GLP-1 agonists. And are there some side effects that you need to be aware of? What about labs? Do you need labs or biomarkers to make sure that you're a candidate? And how do you get started? And I do have some pictures at the end to show you just a few of our patients, and you may recognize some of them. And I got their permission to post their information. So let's get going. Now, obesity is considered a chronic, progressive, debilitating medical condition. So it is a disease. It's actually at the 1 in 8 of individuals. When we're actually looking at the statistics in the United States, you're going to realize that a whole lot of persons in the US, more than 50%, are considered to be obese. And more than 75% of the US population, and I'm just talking US at this point, they are considered to be in the overweight category. So what is overweight and what is obese? Overweight is a body mass index that is greater than 25. It goes all the way up to 29.9. And then the obesity category is actually started at a BMI of 30. And obesity is actually broken down into different classes once you have been diagnosed. So your typical class 1 obesity is going to range from 30 to 34.9. The class 2 obesity is going to range from 35 to 39.9. And then we have decided that anything over 40, when you calculate that body mass index, that is considered class 3, or you may hear the term morbid obesity. Now, the one thing I want to make mention of here is that sometimes people think, I am not as fat as that one. But when you do their calculations, they may find themselves in a class 2 obesity while their counterparts are in class 3. It's good to note that regardless of where you find yourself, as long as you have that risk factor of obesity, you are literally putting your life at risk for many of the chronic conditions that were mentioned. And it is one of the top 8 problems in the United States that will lead to early death, that is preventable, and disability. All right? So let's talk about the funds, because we know that this is a big thing for all of us. Every single world leader is concerned about the amount of money that they have to spend. So the global burden of the disease of obesity, in a few years ago, when I actually did this study, was upwards of $160 billion within this little United States, not the world. So if you have to think about $160 billion for just the US, and we have so many other first world countries and developing countries, you can just imagine the global burden of this disease. So when you hear somebody the next time say, go drink little lemon water and run, You want to know how is that working out for everybody else, the 50% of the world's population who is obese, right? Now, the global epidemic of obesity, because it is an epidemic based on the number of persons that are impacted by this chronic condition. So it impacts more than 700 million individuals across the world. And in the US, like we mentioned, more than half the population has a BMI greater than 30. And that's quite interesting to note. Now, there are many different implications to obesity. We're talking about it being a national threat, right, to many, many millions of persons in the world. We're talking about the global burden of the disease and also the things that are linked to obesity. So Mr. Thomas already mentioned a few of these, but of course we know many of them, right? But I will add to that childhood cancers and even some adult onset cancers are related to obesity. Infertility is a big one. Sleep apnea and early death from sleep apnea. There are some autoimmune conditions that are also linked to obesity. So you can see that this particular disease process is really, really running amok within our countries and within the world. And so it has been a good thing for us to be able to find different therapies out there that will help to mitigate some of the impact that obesity has on our communities. All right. Here again, a little bit more of the implications. The cost just to stay in a hospital, right? You're staying in the hospital longer, so there's this increase in length of stay. A lot of these patients are coming in with so many other comorbid conditions that it makes treating them not just expensive, but also very difficult. And this is going to be where a multidisciplinary approach is going to be necessary, because obesity treatment can never ever be a one size fits all. It really requires multidisciplinary approach. So you may have your primary care person, you may have an intensivist that's assisting, certainly your dietitian and nutrition department, maybe some physical therapy for the individuals that are now bedbound because of this. So you can see that it impacts every aspect of our lives. Now, there are some things that really, really cause persons to be obese. And unfortunately, for many of the Black and brown individuals, and by that I mean our Black people and our Hispanic people, we face some of the highest disparities in healthcare, many times because we don't have the coins. The access to care is not necessarily readily available for the individuals who are below the poverty line. And let's just be clear about that. So many times when there are things that can be done, there are therapies that come out, the first thing persons are going to ask, how am I going to be able to afford this? Especially given the fact that they may need to choose between purchasing their insulin, for example, versus a gallon of milk for their children for that week. And we don't have as many programs to support the less fortunate and the disenfranchised. People from lower socioeconomic backgrounds, we just don't have enough of the resources to do that. And that is not just a US problem, that is a worldwide issue. Years ago, they pulled out quite a few things out of our diets, even here in the US. So now we are inundated on the market with a ton of calorie dense, meaning high caloric foods, and they are of low nutritional value. And these are some of the other things that can lead to obesity, right? So, tons of calories, lots of saturated fats, lots of processed foods with a whole bunch of toxins, all leading to obesity. So, how do we even begin to talk about managing this chronic condition? Because it seems like no matter what is employed, we're not seeing a big drop in the amount of individuals that are facing this chronic condition. So, the proposals in many of the dietary guidelines, they say we want to, of course, add healthy eating patterns across the lifespan. So I know for many of us, the adults are no saying, let me do this, but then they still buy the other things for the children in the household. But the guidelines are now recommending start them young, because when you get them used to whole and nutritious foods that are great balance of calories, great balance of the macronutrients like their proteins, their carbohydrates, their fats, then this is something that is embedded in them from early and they can carry on throughout their lives. We're thinking of limiting the salt intake, as Mr. Thomas mentioned, limiting the sugar intake, and choosing some healthier options for even the beverages that we're consuming. And as I mentioned before, it requires a multidisciplinary approach, and over time, we need to be more innovative with the strategies that we are employing, because it is truly not a one size fits all. It requires help from every single discipline to help an individual. And of course, the last but not least, which is what we're really going to discuss tonight, is the meaningful use of medication or pharmacological therapy that will help to mitigate this chronic condition. So let's get into it. We are having a showdown here tonight, and we're having a showdown between Ozempic and Wegovy. Let me preface this by saying that Ozempic and Wegovy are made from the same molecular structure. So the molecule that makes up these two drugs is considered semaglutide. So you will hear the term semaglutide used throughout this presentation. I'm still referring to Ozempic, which is the brand name, and Wegovy, which is another brand name. Okay? Now, let's talk about Ozempic. We've all heard the advertisement, Ozempic, and they tell you all these great things about this therapy. And then at the very bottom of the page, you see some jumbled writing, things that you couldn't even try to understand. And they rush through those things very quickly. But we're going to dive into them tonight and ensure that at the end of this presentation, you will walk away feeling more empowered in making a decision about your health and whether or not the GLP agonist therapy of Wegovy / Ozempic in the form of semaglutide will be worth it for you. So let's talk Ozempic. Ozempic has been FDA approved in the treatment of individuals with type 2 diabetes. They have approved this medication probably about 8 or 9 years ago. But the class of drugs that are known as the GLP agonists have been around for more than 2 decades. So I know that I'm 21 years old. Dan knows that I'm 21 years old, but 19 years ago, when I just started this, I used to administer two of the first GLPs that were on the market. They were the first injectable GLP agonists, and they were Byetta and Bydureon. And this was 19 years ago. So I know the medication class has become a little bit more of the flavor of maybe the last few years, and it's the most talked about, but the therapy is not new. It has tons of research to back it up, and it's been around for a very long time. I'm going to pause here to say this. What I found interesting in my time in New York back in 2005, administering these medications, the individuals who were able to pay for this therapy, because what insurance? No, 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 no insurance, right? The individuals who could have afforded to pay for this therapy were paying upwards of, and are you ready? $4,500 US on a monthly basis. Clearly, these individuals didn't work our job, because there is no way any of us could have afforded that level of therapy. Couple of other things that I would make note of. They didn't look like the quintessential diabetic with that moon face and obese trunk and, having the neuropathy and all of the other things that happen with the diabetic condition. They look snatched. They had their hair done, nails done, and a lot of them were dropped off by limousines. And I've had a few who came in by helicopter. So that gives you an idea of the individuals back then who were able to benefit from this therapy. With time and with education, many of the insurers started to get on board, but it would be pulling teeth just to get an approval for something that was over $4,000, which is 4 injections. That's it, 4 injections. And that was the monthly cost. No, FDA approved for treating type 2 diabetes. This is considered to be one of the incretins, and incretins are a type of hormone that is stimulating insulin. When it stimulates insulin, we all remember a bio class we took a long time ago, and it says that insulin was released in response to high blood sugar in order to bring that blood sugar back down, and we live happily ever after in homeostasis. That's in the real world, in the nice, perfect system. So this medication helps in the stimulation of insulin. It inhibits the secretion of glucagon. What was that glucagon again? That was where the sugar was stored in the liver, and it became glucagon, right? And whenever there'd be time of stress or need for a little bit of extra sugar in the body, then the liver will send the glucagon out and blood sugar would be raised. I know some of you remember that class. And in doing so, this medication has been helpful to actually lower blood sugar. So it was very effective as a treatment for type 2 diabetes. In addition to what it has been touted for and FDA approved for, it reduces your appetite, even though it is not considered an appetite suppressant. And I like to distinguish that, because sometimes people will think that if they're on the therapy and they feel hungry, that the system is broken and the medication is not working. And it couldn't be further from the truth. It reduces your cravings. And I will tell you, it will change your relationship with food. It is something very difficult to explain until you get there and you're like, okay, I understand what she was saying. It's the kind of medication that makes you come to Jamaica and you drive past the KFC at Harborview, which never happens. And then you get into New Kingston and you drive past that KFC in New Kingston and you get to your hotel and you're asking for the menu and you're looking at the menu and the Cobb salad sounds amazing. The Brussels sprouts are what you're craving. Real talk, true story. It also helps with, decreasing your desire for more fatty foods, for things that are calorie dense and low nutritional value. So this GLP agonist in the form of Ozempic, solid medication. Now, the one thing that was found in the studies, and I think it was truly by accident because they were pretty much bringing a few people together, and I'll discuss the study in a moment. They were bringing these people together to really just see how their blood sugars were going to respond to semaglutide, the molecule, in comparison with a known anti-diabetic medication that is on the market, and then there is a placebo, right? So these are randomized controlled trials, and these are some of the highest level of research that can be done. So when they're done doing this research, you can bet your bottom dollar, whatever the research has come out with, it's solid and it later on can be added to your clinical practice. So what they found is that in addition to the things I mentioned in the previous slide, Ozempic is helpful in reducing body weight. They are still trying to figure out, how did this even become a thing? There have been many theories. Was it because of the lower blood sugars and the decrease in the amount of insulin that needed to be released because the sugars were normal? Was it a reset of metabolic dysfunction? What is happening? Because people are losing weight on this therapy, which was not the intended effect. The second thing, as I mentioned, there is a reduction in how much energy your body actually needs, and therefore your appetite is also reduced. Because if you're using less energy, then you don't need to consume a whole bunch of food to do that, right? And it also helps us to change up our portion sizes, whether we want to or not, whether we planned to or not, because the medication has been shown to increase satiety, right? Feeling fuller for a longer time frame. That's what satiety means. Now, here is the clinical trial that everybody has actually been talking about for the past few years, because Ozempic was such a novel finding, and what it did was show how much weight persons could lose. But in addition to that, the blood sugars were well controlled, and the other diseases of lifestyle, like the high cholesterol, the elevations in your blood sugar, right? The elevations in your blood pressure or hypertension, those disease processes actually improved significantly as well. So there was less cardiovascular risk factors. So this nice heart, they were seeing less heart attacks. They were seeing less transient ischemic attacks. They were seeing less blockages of those tiny coronary arteries requiring major interventions like bypass. So something was really up with this therapy. It was touted almost too good to be true. So here is the SUSTAIN trial that was done on Ozempic. It's semaglutide unabated sustainability in the treatment of type 2 diabetes. Long word for sustain. There were 7 randomized control phase 3 trials. Now, if you know anything about clinical trials, once you get to phase 3 of a trial, most persons are very, very confident that they can actually start producing this particular therapy. Phase 3 is that phase that is that make it phase. It means that they have ameliorated any issues in phase 1, they've worked on anything in phase 2, and now phase 3 is just where things are nicely wrapped up, put on a bow, and sold to the highest bidder. So there were 7 of these trials. And we had over 8,100 participants in these trials. Male, female, no children, and no pregnant women. And the individuals that were a part of this trial, majority of them had type 2 diabetes. But in addition, they also had other chronic conditions, the ones we mentioned. The high cholesterol, the hypertension, right? Some of them had a history with fatty liver disease, non-alcoholic fatty liver disease. That is as a result of elevations in your blood lipids as well. So the studies showed that there was improvement in glycemic or blood glucose control without causing hypoglycemia. And I want to pause here because Ozempic, Wegovy, the molecule semaglutide is not an hypoglycemic agent. It's not one of those diabetic agents that can cause hypoglycemia, like insulin could, or a sulfonylurea could. These are the ones that can definitely change the blood sugars very rapidly. But it lowers the sugar back to homeostasis, not much lower than that, okay? There was increased weight loss in comparison with the placebo that was used. And of course, as I previously said, lots of changes to the cardiovascular related events. Less heart attacks, less TIAs, less coronary artery bypass surgeries, and I'm sure less strokes. All of those things had some big impact on the lives of the individuals in the studies, over 8,100 individuals. Now, how do you dose this medication? For individuals, again, who are diabetic, many of them are going to have a pen. It looks like the exact pen in this picture here. So this is the brand name medication that is being injected. You will start at a low dose, regardless if you had a BMI of 50, or you were 500 pounds, or you were just 200 pounds with a BMI of 34, you are going to start on 0.25 milligrams. And most persons don't understand why, and this is my why. Many of us went to basic school, I hope. And if you live here in the United States, you send your children to kindergarten. There are certain tools and new knowledge that your babies are going to learn in basic school and kindergarten. So we learn the art of playing with each other in the sandbox. We learn the art of tracing our name. We could identify our colors. So there are some integral and critical things that have to happen in that particular time frame of our lives. so that when we get to grade 1 and grade 2, that particular teacher now doesn't have to tell us how to trace our names. They don't have to show us that this is yellow. What are you doing? Did you go to basic school? What is the point of what I'm saying? Building on that foundation is going to be important. So the foundation has to be solid. This is why we don't send our children to just any and any kindergarten and any basic school. And we also educate them at home. So with this 0.25 milligram dosage, it is the starter dose. I have zero expectations for anyone on this starter dose. Yet, in my career, I have seen some very interesting weight loss on this starter dose in the first month. But I like to tell my patients that this is not a guaranteed thing, because the goal of that 0.25 milligrams is simply just to get the body acclimated to the medication. It is to stimulate those GLP receptors that we were all born with. They line our entire intestines. And the 1 time per week therapy is there to stimulate these receptors to start working again. Many times they stop working for several reasons. Chronic conditions, diabetes, high blood pressure, all the ones we've mentioned. There could be toxins that we have inadvertently ingested. Look at the foods that we're eating. Sometimes the chicken looks bigger than you. And if you are someone who's poor or have limited means, you're probably looking to get the bigger chicken because you've got a family of 5 to feed. You can't afford to go to Whole Foods and buy 1 chicken for $15, right? So essentially, it is stimulating these receptors to start working optimally again by increasing the feeling of fullness and satiety. So there is this signal that it sends to the brain to do that. And if you're eating something, the brain and the GLP receptors will sort of talk to each other and say, shut her down. She's had enough. Which is why in the previous slides I said, whether you like it or not, it is going to change the relationship that you have with food. You are going to look at a lot of things and just be shaking your head like, I can't have that. Not because you don't want it, and not because you wouldn't try a little piece, but there is almost like an aversion. And people who have been pregnant can understand that concept, where ackee and saltfish is their favorite food, but don't try it in the pregnancy. They're going to throw up. Something similar happens with the GLP agonist. So that is our reason for starting at such a low dose. It's just to get that metabolic reset happening. So don't be discouraged if the blood sugars didn't get controlled right away or the weight wasn't seen in terms of weight loss. The next set of doses, 0.5 every week for a month, 1 milligram every week for a month. And then recently, about maybe 2-3 years ago, they came out with this new 2 milligram dosage for Ozempic, because it used to stop at 1 milligram. So this is Ozempic in a nutshell, okay? Now, moving on to the alternate option, which is semaglutide in the form of the brand name Wegovy. Wegovy came about on the scene in about September of 2021 was when we officially received the update from the FDA that we had an anti-obesity medication that worked similarly to Ozempic and was causing significant changes in the SUSTAIN trials, the ones we just talked about earlier. So not only were they seeing changes in cardiovascular related events and lower blood sugars, but now people were starting to lose somewhere between 15 to 22% round about there of their body weight over a 1 year period. Most times these studies are about 48 weeks. So over that time frame, significant weight loss. Because let's just be clear, we've all tried the lemon water. And, it flushes through some things a few days and we lose maybe a couple of pounds here and there and we feel great. And then we didn't drink it after that. And the next few days, we're right back to square one. But with this therapy, what they realized, people actually were able to keep this weight off. And the persons who potentially regained weight decided that they were not going to end any maintenance, which I'm going to talk about because that is going to be very important. Okay? So Wegovy, FDA approved for the management of obesity. And this is where I get to look at everyone and say, for all those who said that people who were taking this medication were stealing from diabetics, please, after tonight, you have no excuse. You cannot use those words again. And every time you hear those words, please check that person and let them know there is a medication called semaglutide in the form of Wegovy that is FDA approved for weight loss. So no, we're not stealing diabetic drugs. This, similarly to Ozempic, lowers the risk of major cardiovascular event. And Mr. Thomas said, well, what age can people start this therapy? And it is indicated for individuals 12 years or greater. And I did mention that children were not included in the SUSTAIN trials and pregnant women were not included. But we are finding more and more that our children are becoming more obese earlier on in life. And it goes exactly back to what I had mentioned. The parents are trying to make the modifications because these knees that used to do the butterfly and the ankles that used to roll when we did the log on, yeah, they're not kneeing and they're not ankling anymore. And those are not words, but you get my point. So the parents are trying, but they have not yet made this a family event where children can now get involved and get better nutritional choices at meal times. So 12 years and older, that's the indication. Now, the dosing guide for Wegovy is quite similar to that of Ozempic, with the exception that in the 4th month of therapy, because each of the doses go for about a month and can go for much longer if an individual is doing really well on that dose, or if the individual is having significant symptoms, it doesn't make sense to increase it. So in month 4, they have added a 1.7 milligram dose. So instead of going from 1 to 2 milligrams, there is a little bridge dose right there. And then in months 5 and onwards, until sometimes even a year or two, until people have accomplished their weight management goals, 2.4 milligrams subcutaneously once per week. And that is the goal of the therapy. All right, this is our dosing guide here. Now, I wanted to just include a couple of slides here that will show you about places that you can give subcutaneous injections. I don't want to make the assumption that we have all clinicians here tonight, but that there are individuals, lay individuals in the audience who may have never given a subcutaneous injection. So we'll start off with the fact that majority of persons are very familiar with the abdominal injection. And we try to stay at least 1 to 2 inches away from the umbilicus. There are tons of nerve endings and blood vessels here, and we don't want to inadvertently inject in one of those. So there's all of here that you can do your injection. This here represents the back of the arm. It's like towards the side, but closer to the back of the arm. And you could see it better in this picture. That is a nice subcutaneous site. But I will say this, for injections, unless you have assistance, this is going to take some level of dexterity. And another area where you will see persons do their injection is the anterior thigh, right in this area. Some people will go even closer to the inner thigh and a bit to the outer thigh. So they'll get 3 different spots where they can inject. And my recommendations to all of my patients, ensure that you are actually switching up your injection sites. And of course, we have the flank area here, right at the top of the buttocks, right there. So someone might have to do some assistance with this as well, okay? Now, how do these medications work? And I think this is the big question for many persons, because you have heard tons of things. You've seen the news articles. You've heard the, I guess, findings from persons, which are mostly opinion papers. But here we are getting the research from the research person tonight, because my doctorate, my thesis was solely based on mitigating the impact of obesity in the African American community. So when this therapy came about and it seems new for everyone, I was just chilling because I had access to every single weight loss medication you could think about. So very well versed in these. So let's start off with the function of GLP and how it relates to different organs. And this is a busy picture. I'm not going to read each thing, but just so that you can get a good, idea of what each thing will do or how it responds to the GLP. So the brain, we've already said, increased satiety and decreased appetite. So you're getting some level of appetite suppression, even though the medication is not an appetite suppressant, okay? Your heart, your blood pressure is gonna go down, your heart rate will go up, especially with Wegovy. We don't see that as much with the Ozempic medication. The kidneys get to release a little bit more sodium out of the body. That is what natriuresis means, right? There is increased glycogen synthesis in the muscles. More glycogen is being made in the muscles. And this is the part that people love, the adipose tissue, the fatty layer. There's increase in lipolysis, which is basically fat burning. There's increased glucose uptake as well. And the liver can decrease how much glucose it is producing. It can decrease the fact that it doesn't have to keep releasing glycogen into the bloodstream to increase glucose. So the liver gets a break. The pancreas, there's increased insulin secretion and a decrease in glucagon secretion. And of course, those beta cells in the pancreas, I think they are the hardest working people. They're like your janitors of the school, where they are literally everywhere. They don't just take care of the bathrooms, they will do everything. That is the beta cell in the pancreas. There's a beta and the acinar cells. Well, the beta cells, they are so hard at work, releasing insulin every day. So can you imagine if your blood sugars were always high, how much work this beta cell has to produce? And this could lead to burnout of the beta cells and, malfunction of the pancreas. So we can see how there can be quite a bit of metabolic dysfunction happening in our bodies. So when we're introducing this therapy, these are some of the things that the therapy has to try to correct. And most of us want to see this after one injection. Silly us, right? And of course, with the gut health, there is a delay in gastric emptying. So the transit time for food is slowed going through the gut. So very slow transit time. And this can be like a double-edged sword in a bit, because slow transit time is increased in satiety and fullness, but can be, intermittent nausea or maybe queasiness, a little bit of distension of the abdomen, a bit of more gas in the abdomen, and for sure constipation, which when we get into side effects will make a little bit more sense. All right. So here we go. We have heard it all. We've seen it on CNN. We have read it on Pinkwall. We've gone to Facebook, and how could I forget? Dr. Google said that these side effects. So let's actually talk about the real side effects of this medication therapy, because I want persons to be very clear about these when they're making their decisions about if this therapy is good for them. So with the class of drugs, the GLP agonists, because they are focused on working in the gut, in the intestines, majority of the symptomology that you will experience will be related to the gut. So I've mentioned that queasy feeling, the intermittent nausea, possible vomiting. And to be honest with you, with the years of giving this therapy, I haven't seen this vomiting. And when I hear about it, I would ask the first question: how much of your dose did you take? Because people have a mindset that higher doses lead to faster weight loss, but higher doses can also lead to more symptoms. So the vomiting, not so much, but the nausea, intermittent, but easy to manage. And for us Jamaicans, we always have a mint candy in our bag. We always have some peppermint tea at home. We've got ginger. We have a sugar-free gum. And of course, if it gets really bad, you can talk to your clinician about getting some Zofran, some Phenergan, some Reglan, Compazine. There's tons of them on the market as anti-nausea medication. So the constipation is the second one. We already just mentioned that, because the slowed transit time leads to that constipation, because you're feeling fuller longer too, but constipation is a side effect. These top two things are probably the most reported out of any of the other symptoms. So diarrhea is possible, and many times when I see diarrhea, I will ask, what were your last set of meals? Because if you had some fatty meals, diarrhea. If you had some spicy meals and continuously do that, diarrhea. And if you took your dose and didn't take the right amount because you wanted more rapid weight loss, diarrhea and vomiting. Bloating is another big one. Abdominal distension, we talked about the gas. And for persons with a history of, cholecystitis, so they're having gallbladder issues, they might have gallstones, and every now and then those stones act up. I would want to be very cautious with the use of this therapy in this kind of a patient. Now, there's also the risk factor and the side effect of acute pancreatitis. And I will tell you that it's not necessarily the medication itself that can cause a pancreatitis, but it can certainly exacerbate the condition depending on the foods that we're eating, water intake, especially those fatty food, guys. Your gallbladder and your pancreas are not going to be happy. And anytime I see hospitalizations from this type of therapy, people being on the therapy, and you really do a deep dive into what happened in the past, maybe 48 hours, you're going to hear the real truth. But what you see on Facebook and what's posted on the media is that it's acute pancreatitis and gallbladder, but we don't know these persons' history. Therefore, it's important to maintain a good provider-patient relationship so that you could reach out and ask these questions. Because sometimes when you see these things, it really does deter you from whether or not this therapy would be good for you, right? How do I know if I qualify for this? So I am using the letters W for Wegovy and O for Ozempic. And just to answer a few of these, so you have to be 12 years or older. And no, you cannot be actively pregnant, but you can use this therapy to help you in your pursuit of pregnancy. And most of your GYN/OB doctors will say, stop the therapy within at least 6 to 8 weeks of trying to attempt a pregnancy. We want it out of your system. Okay, so diagnosis of type 2 diabetes. In order to get insurance coverage here in the US for this, you definitely need that, and that's for Ozempic. Body mass index greater than 30, right? So this is obesity, of course. You do not necessarily need that for the Ozempic, but for Wegovy to qualify for insurance, you do. And I'm stressing insurance because I'm going to talk about something else and how persons can get it without insurance. You could also have a BMI greater than 27, but the insurers would like to see that you have at least one chronic condition, one other risk factor. So if your BMI is 27, then they want to see some high cholesterol, prediabetes, some insulin resistance, things like those, hypertension even. And this part here, these two things are on the box. It's a black box warning for individuals. And I want you to pay attention to these two things that will tell you whether or not you qualify. You should have no personal or familial history of medullary thyroid cancer for any of these GLP agonists, but specifically tonight, Ozempic and Wegovy. And I want to pause here. Medullary thyroid cancer is probably one of the rarest forms of thyroid cancer that exists in the world. When I did the research on it, it seemed to be like almost less than a percentage of the world's population had this condition, and it was diagnosed very early, like in the teenage years and in the 20s. So medullary thyroid cancer has never been found in any of the human studies that were done on the GLP agonists. Can the church say amen? Medullary thyroid cancer was not found in any human studies, okay, with these medications. In the lab animal study, this was found, medullary thyroid cancer. But our thyroid gland, in comparison to that of what is in the rats, different genetic makeup. However, as a word of caution, they are saying, if you have this, do not take this medication. So you could have had another form of thyroid cancer and still be able to take this. You could have an autoimmune condition like Hashimoto's, where you have hypothyroidism, or Graves' disease, which is hyperthyroidism. You still can actually participate in the therapy. So it's just a medullary thyroid cancer. And then no risk factors for multiple endocrine neoplasia. Big word again, but essentially multiple tumors along your endocrine glands. We don't want you to have that. That is a black box warning as well. So persons seem like they need to have generally good health. They don't have to come in with perfect health, but they need to make sure that they know their history, and these two major black box warnings are not something that they have going on in their family or with them personally. And of course, allergies to the medication, and as I mentioned, general health. All right. Now, I am going to say here that many clinicians do not get labs prior to initiating this particular therapy. I am not many clinicians. Can I just say this, that many times people will come to me for their therapy and I talk to them about the labs that we're going to get done or that I am requesting for them to get done. And then a little word like leukemia shows up on a CBC, like very odd thing. Why do you have so many blastocysts? Like, why is your white count looking like that? And then further workup and somebody's diagnosed with leukemia. Now, can you imagine, had I not done my due diligence and not checked for any of the labs, not just the CBC? So I don't know if this person is a brittle diabetic with an A1C of 13 or they were normal. Because if their A1C was 13, then I need to have some significant goals and maybe adjunct therapies that are going to be in line with this Ozempic, right? I might need to have something on board that's going to help with insulin resistance. So that could be your metformin or my favorite herbal supplement, berberine. What about that lipid panel? What if this person showed up with triglycerides in the 300s and they had a total cholesterol well over 250, LDL 200, HDL 30, and then their ratios look like 7? And you're sitting there going, oh my goodness, this person is a ticking time bomb for a cardiovascularly related sequelae. This is a person that might need the adjunct therapy of statins, right? Or they might already have passed that and they're now at risk for having these surgical procedures for bypass. What about the thyroid panel? Thyroid panel is great to have, but I feel like also a thyroid examination, physical examination of the thyroid. I'm feeling for an enlarged thyroid or any nodules on the thyroid at baseline before the therapy starts, so that in the case where 2 months later you came in and you said, you know, I've just been feeling hoarse, my voice has this sexy voice, and I would just call you like this and check, and if that were the first time I was checking, many people would automatically think that the medication caused them to have these nodules or an enlarged thyroid. But because nobody did a baseline, who knows? And in the land of Sue, where Sue is the favorite woman for all Americans, she comes out readily. And of course, personally, I do a fasted insulin on all of my patients. It helps me to sort of navigate those with insulin resistance. And sometimes you look at that normal panel and you see a range of numbers. But in my personal and professional opinion, anytime I see a fasted insulin greater than 8 or even 10 on that scale, even though it goes up to 25, that person already has some level of insulin resistance happening. And as you know, insulin resistance makes it difficult to even try to lose weight. Now, here are some key points that I would like to leave with you if you decide that you're going to use this particular therapy, for whether for weight loss in the form of Wegovy, semaglutide, or for type 2 diabetes in the form of Ozempic. So, older than 12. And the second one, I do not budge on this. I do not budge on this, and I do not skimp on the time that I sit to do this. Patients have a way of just wanting a quick fix. They want a pill, they want a shot, and it is supposed to be magical and work immediately. And I have heard of cases where people were giving and selling their medications to individuals who wanted the fix of the weight loss. But as I mentioned before in the previous slides, what if there are underlying medical conditions that I was never privy to, but I just gave you this? You didn't tell me that your mother had medullary thyroid cancer. You shouldn't be taking this. So a baseline, comprehensive, deep dive into your business, your history, allergies, height, weight, personal medical history, surgeries. I want to know everything, including the gardener who you use, because it is important for me to ensure I first do no harm and that the therapy is indicated for you and you can be safe to use it. Again, baseline lab testing is recommended, but not necessarily done by all clinicians. Generally healthy status, and my favorite, it requires a prescription. No, you cannot just buy this off of someone. You should not take your family's medication. You need to have this prescription. And the only way I can prescribe this therapy for you is if I've had a consultation with you that is paid, because it's 1 hour of my time with you to discuss. And if you're in the US, in Florida specifically, where my office is, I throw in your lab results and your labs for free with the consultation. So that's a complimentary part of what we do for our Florida patients. Trying to figure out how to do it for Jamaicans, but boy, and the lab's expensive. Okay, you also need to commit to consistency with follow-ups. So you should not just grab this med from someone who you will never ever see again. Because guess what? They got it from me for 60,000. Yes, man. I'm gonna get the full therapy for 60,000. And someone who went through the proper channels will come and say, 60,000, really? You know, I bought mine and it was about 175 for a 12-week program with full support and so on. It sounds expensive at the beginning, but what you're getting, you got 4 injections for 60,000. So let's do the math here. So a lot of people will jump on this because of the price, not recognizing that not all cheap is cheap, and your health should never be one thing that you decide to go to the cheapest bidder for. So consistent follow-ups are important, especially when you are changing doses. I want to know, is the therapy that I put you on causing you untoward effects that are impacting your quality of life, and you can't sit up at your desk and Dane can't go to work because he is puking his brains out and he's consistently having diarrhea from the therapy? And I had to use you. And of course, follow the dosing guidelines. Guys, it's not going to kill you to stay on 0.25 for the 4 weeks. I have seen someone lose 100 pounds over 1 year on 0.25. She never had to move because that was her sweet spot. Everybody has a sweet spot in terms of a dose that just does it for them. And for her, it was the starter dose. Who knew? Now, this comes to the end of my presentation, and this is where I want us to debunk a few of the myths that have existed with this particular type of therapy. And I don't know if Dane is actually available, because I will need a little bit of help to sort of go through this, because I want to see, were persons paying attention with me talking about this? Because a lot of the questions that I have here, is it a myth or is it the truth? Those were answered in the presentation. So Dane, are you available?
Yes, I'm here. Right
Mr.
here.
Thomas? Okay, so I just want, I don't know if you have persons that are in office with you today, or you can see the persons on YouTube and the persons on Zoom. I am going to mention something, and I want you to tell me how many persons are saying myth or truth. Okay? So, GLP agonists are new therapies.
Myth or haven't we gotten a response as yet?
I'm sorry, say that again. You're a little low.
Oh, I haven't gotten a response yet.
Okay, no
Yeah,
responses yet.
somebody said yes.
Anyone on the Zoom? GLP agonists are new therapies. So let me open up this chat. Talia Powell says it is a myth. Thank you, Talia. I don't have a price for you, but it is a myth. Not a new therapy, well studied medication class over the past 20 odd years. GLP agonists are only for diabetics. We just talked about this. Myth or truth?
Um, I'm not sure if this is the question that she's answering, but the person said, I got in late, didn't get the full info.
Oh, okay. So the question is GLP agonists are only for diabetics. Is this a myth or is this the truth? So, based on this whole presentation tonight, no one? All right. Well, it's clearly not because Wegovy is FDA approved for weight loss.
That is correct.
Persons, oh, iPhone, you jumped in. Thank you. Persons taking a GLP agonist are stealing meds from diabetics. Thank you, Dr. Bailey. That is a myth. You have to be considered obese in order to start taking these meds. Working. It is not working. It is not an appetite suppressant. So something like phentermine being a stimulant, phentermine acts as an appetite suppressant. So that would be expected of that particular drug. Dysfunction out of our lives and out of our families' lives. We don't want no part of our foot being cut off. We don't want no part of dialysis. We actually want to maintain the good health that we have gotten after we have taken these therapies and met our weight management or health optimization goals. So you may gain some weight, but be on a maintenance program that you have discussed with your clinician. It might not necessarily be the GLP agonist. It could be half a pill of phentermine. It could be Contrave. It could be AOD 9604. These are peptides that help with that as well. So many options, guys. No reason for you to gain that weight back. All right? And a couple more. Just take the shot. Take this shot. You don't need to do anything else. You don't need to do any lifestyle changes. Girl, take the shot. Myth or truth? Oh, baby, iPhone is like banging here tonight. There is no magic injection. Do not call me after 2 injections with expectations that are unrealistic. Before you reach out to your clinician, reset your expectations and revisit the information and the notes that you took here tonight, because the therapy, the studies were done for 48 weeks. So how could we expect that after 2 weeks, 2 injections, I didn't lose any weight? So I'm waiting for the next part of her question. It's like, oh, that was it? It's like, oh, okay. All right, I'll talk to you in a few weeks, because bombastic side eye, right? You are guaranteed to have significant weight loss with this therapy. Significant. Not true, Talia? Myth, myth, 100%. Do people lose quite a bit of weight on this program and, with being on this? Absolutely. But significant weight loss, like this whole thing, it is not a promise. We can't promise you anything. We don't know how your body is going to respond to the therapy. These medication cause thyroid cancer because me know somebody will it kill. iPhone. So this is school challenge quiz and you put in your answer before the buzzer. Yes, it is a myth. No human studies were found for any type, and certainly not the black box warning of medullary thyroid cancer. None. Just the rat studies, the animal studies. Okay? This is another favorite of mine because it was on CNN 2 years ago. And I had to put it in here. These medication, me know somebody who for belly. Yes, girl. Gastric paralysis, gastroparesis. Yes, girl. 100%. Yes, girl. Why Talia said myth? Why iPhone said myth? On sure you never hear about the one there. So remember how the medication works. It slows down transit time for food through your gut. And with a slower transit time, that is how it works. No, imagine you have underlying conditions that can predispose you to gastroparesis. By conditions, I mean type 2 diabetes. What? What about those autoimmune conditions sometimes too? What about those? Did anybody know that alcohol? Yeah. Ray and his nephew, gastric paralysis. Yeah, we knew that one. Okay. Whole heap of medications that we take over the counter. I'm afraid for telling about them. But I want you to look at a list of meds that you take over the counter that can cause gastric paralysis. We know the anesthetic meds, of course, but there are tons of them. And the good one that my brethren Dane loves, I'm just joking. But the marijuana that grew on somebody's grave that everybody's smoking, right? The THC and the CBD guys. Yes, man, the good old sensimina. That in itself will cause gastric paralysis long before a GLP agonist causes gastric paralysis. Yeah. I want you guys to go take a look at the medications over the counter. You're going to be, when me young people them say, you're going to be shooketh. Last but not least, patients with a higher BMI. So their body mass index, very high. They have on a lot of weight. These people need a higher dose. So you're going to put me on 0.25, doc? You're crazy. I want to be on 1 milligram because that's what my auntie and my auntie's gardener and the guy that sit behind us in church taking. iPhone says myth. Anybody else? Beg to differ. Dr. Bailey says myth. Anybody else? Nobody know want to start at 1? No? Okay. Patients with a higher BMI, patients who know the president, patients who are good friends with Dane, patients who, I don't care. You start at 0.25 milligrams for 4 weeks. And that is the end of the story. That's all she wrote. No. How can you get started with us if you decided? Dical Health and Wellness. We are the quintessential care providers who really actually live what we teach. And I'll show you some pictures of somebody you might recognize because that person has been using the therapy, and you're going to just be like, whoa. So you need to schedule a consult. That is important. The consult can be done via a telehealth measure or in person. So come to Florida, come look for me, man. South Florida. It's like a Jamaica, 954 Jamaica. So that consultation is going to do a deep dive into your history, identify any risk factors, all the things we mentioned. We're going to get the baseline labs. Either you can get them with your primary care through your executive panel. You can message me and say, hey, what labs would you prefer for me to get? Because these aren't the typical ones that all persons will order. And I'll tell you exactly what I would like. And your PCP can get them, fax them into me, email them into me, telepathy them into me. Just get them. And then once you've gotten started, we've gotten your medications and so on. Typically from your interview with us to the start of the program is about a week if you are in the US. If you're in Jamaica, then we would make some dates as to when we will be able to get you started. But it's very simple, it's not complicated. So you will attend an injection training and a dosing video. So I'm going to show you, because I brought it because everybody afraid of needle. I don't know what I'm to know. This is an insulin syringe and a needle. That little tiny needle, about the diameter of one of these horsehairs that I'm wearing. That's it. Nothing to write home about. And I showed you guys the subcutaneous sites that are approved before. So that is the insulin one compared to something like this, which is what I get in the vaccines with typically. You know what I'm saying? So this, nothing. All right. So we will train you how to do your injections, and you will do a return demonstration. This is a 15-minute, telehealth, or if you're there at the office, then we'll just do it in person. And then we ask for your commitment to do a follow-up visit with us once a month. That is complimentary. You do not pay a follow-up visit fee. And I'm telling you, these fees range a lot from my counterparts, and I see that. So I have not charged any of these fees for the past 2 years, and we don't plan to. It's a phone call, WhatsApp call, or a telehealth visit if you wanted to see us face to face. You might want to see Kevin, not me. So our program that we really, really would like to talk to you about is called our Power Pack program. It's 12 weeks to start, of course, because everybody's tend to be with us between 9 to 12 months, depending on how much they need to lose. But we go in 12-week increments. So 12 weeks of medically supervised weight loss. You're getting 12 weeks of semaglutide. We cannot afford the brand name of Wegovy. Therefore, we have a compounding pharmacy, and by compounding pharmacy, these are FDA pharmacies that are heavily regulated 100% by pharmacy boards and state boards, and they have to have a 97% of the actual molecule of semaglutide present in all of their semaglutide products. And then the 3% is sometimes made with just fillers, but in our case, sometimes they'll add vitamin B12 or L-carnitine. So 97%, that's the standard for all compounding pharmacies. We've been working with our pharmacy here. We vetted them. We vetted 5 and we chose 3, and they have been very good to us. You, in turn, also get 10 weeks of lipo injections. This is a combination of your 3 fat burners, they're amino acid fat burners with vitamin B12. And if you lack energy, B12. All right. So essentially 22 weeks worth of meds, but if you take them together, then it's a part of your 12-week program. All follow-up visits included. And if some people need to follow up every 2 weeks, it's not an extra charge. If you needed a little bit more hand holding, it's not an extra charge. 24/7 provider patient support via our dedicated patient portal, which you will get to sign up for when you start our program. You get either a digital body scale that gets attached to an app, someone can watch you, so you can track your progress, or a digital food scale that will check not just your macronutrients and your pounds and ounces, but it will also give you caloric intake for certain foods. You get a water bottle because if you ever tell me say you never drink no water because you never have a bottle, problem. You get a measuring tape because the snatcher doesn't always look very physical and we need to do our measurements to ensure that we are still on track. For those who require a physical journal, like there are people who like to write things down, we can provide that upon request. And of course, I'm very big on sharps safety. So you do get a sharps container with your program. And I didn't mention that you get me and my darling husband, Kevin, but goes without saying. So let us look at a couple of these people. This is my friend here. She's my god sister. She is 53 years old and she's provided me with her info so I can talk a little bit about, because she's shared this. 53 years old. She is postmenopausal, and she had a history of gastric bypass surgery and lost 170 pounds. Over time, life was lifing, and she gained some of that weight back. And she came to me, she was very distressed. She's like, girl, I want to go pay your program. It's everybody I lose weight on it. What is this? So we talked about it. And over her first 6 months with us, being menopausal and not wanting to optimize her hormones, much to my chagrin, she lost 40 pounds. 40 solid pounds that she has kept off, and she's now in maintenance and doing very well. Look on the hot girl here. She look familiar too, hot girl, watch her. I had to put the same thing on. This was in Jamaica. Going to Puerto Rico, girl have hips and thighs and boobs and everything for days. And look at the cheeks, right? And then this was in Mexico. After I had started the program, I had lost about 60 pounds already here, not my lowest. But everything else was the same, except look at how the thighs slim down. This is falling off of me. You can't see it in the picture, but clearly way different. 60-pound difference there. Hot girl again. But like her, see? Look at the cheeks. The cheeks were cheeking. The face was facing. And if I had to do a face off, look at the little face. Look at the width of the boobs. Even the bras had to get changed. Waist circumference, girl did start have waist and hips, and I still have my bottom, but it's not bottoming like how this bottom was bottoming. And here is a young friend of mine. She is a young mother who came to me and said, after I had my baby, I wasn't feeling like myself anymore, and I really want some help. What can I do? We got her on the program. She said, I can only afford to do 12 weeks right now, but if you give me the tools and the strategies in this 12 weeks, I am going to do my due diligence to keep this off. And keep it off she has. This, in the first 3 months of the program, resulted in 25 pounds of weight loss. And you can see that clearly. Hot girl, I want a DEM. This is my brand ambassador, my good friend. We have been friends since 1995. Don't tell her I told you because you're going to guess our age. So this was when she started our program. I think this was the first few weeks. And this was close to her 12th week on the program. Her goal, she said, was 30 pounds. And she lost the 30 pounds in the 12 weeks, and then I put her on maintenance. Brought her in for a visit on maintenance, and she decided it was not enough. She lost an additional 10 pounds on maintenance. So now I said, okay, do I need to maintain the maintenance? Because she had still been losing weight. And now she's still on her maintenance, still hitting her goals, left with some good habits that she will learn how to maintain. And of course, this was 6 weeks. This was the day when we talked, our consult day, okay? And this was 6 weeks later. The boobs weren't going anywhere, but clearly, after 6 weeks, the body was going somewhere, right? And this is another young lady. This is not her final thing, but she said before and after. This is actually her true after. This was 2 weeks ago. She has officially lost 80 pounds with us. We started in June of 2023 at a ladies' retreat at church. She attacked me, and I got her all the way together with this program. And look on the nice, cute girl there. Lord Jesus. Look on the face. When people talk about Ozempic face, I don't have a problem, because this, not too nice. Girl, they still have a nice smile, nice hair, nice personality. But look at girl right here, so. And from here to here was my 75-pound weight loss on my first trip around the sun with Ozempic. So, Daikel Health and Wellness, if you'd like to capture our information, you can call us 954-408-0125. And for those of you who are joining from Jamaica, that number you can put in your WhatsApp. So you can call us via WhatsApp or just send us a WhatsApp message. And you have the customer service at daikelwellness.com. For all of our bookings, even for speaking engagements and so on, we speak at local churches. We speak at women's retreats, men's retreats, and I have a very good men's health program. Ladies, wanna call me, and we can definitely come through and see you. Nominal rates, we can work with you. And that is our office. We're located at 2425 East Commercial Boulevard, and that's in Fort Lauderdale, for those of you who are familiar with the area. And now I get to ask the big questions. Any questions for me tonight? Thank you, thank you, thank you.
All right. Thank you, Dr. Clark, Renee, my good friend. Any questions you can send in the chat real quick. Any questions at all? Any questions whatsoever? Well, maybe the information was really concise. Everybody understood all the information given. So you had no questions at all. But I'm sure you might have one question. You might have one concern about the medication, I'm sure, or about anything in particular as regards to weight loss management.
Seems like everybody belly full. Increased satiety has started.
Belly full, seriously.
I love it for us though. So someone says, which lab would we be able to do? Which lab would we be able to do the test if we decide to start? Now, can I ask, are you located in Jamaica or are you located in the US? So in Jamaica, pretty much any of your labs. I have a collaboration with Dr. McLean. She's located at 6 Northside Plaza, 6A Northside Plaza, Suite 10. And the lab is literally right across the street from her office. So if you have a primary care or a general practitioner, someone you go to see, you can ask them for a lab slip with the labs that I've mentioned. And they are the simple ones, the CBC, comprehensive metabolic panel, or a basic metabolic panel. You need a hemoglobin A1C, a lipid panel, thyroid panel, and also a fasting insulin. So all of these tests will be done with you not having anything to eat for at least 8 hours. Best to do in the morning so you're not fasting all day. Okay? Not sure if it was previously said, but is Wegovy or Ozempic available in pharmacies in Jamaica? So, I'm not quite sure of other places, but Mr. Thomas and I will be collaborating on this where we will be able to assist with individuals. So, like, it's the whole program, right? So it's not just going to the pharmacy. You'd go through the full process of the program. And in terms of procuring the med, he can either get it there for you or we can get it to you. But there's a process that we can discuss on a one-to-one basis during our consultation. I don't want to give you no secrets, trade secrets. But good question.
Dr. Bailey, not sure if it was previously said, but is Wegovy Ozempic
Yeah,
available in pharmacy?
yeah, just answered, asked and answered. I sound like me a lawyer, nice. I'm so sorry. Is it possible to put back the, I didn't see the question, sorry. There's something about a test someone was asking. Did you see that question, Dane?
Yeah, I'm not sure. It was a saying
Someone said, yeah, someone said, is it possible to put back? And then I didn't see anything else. Let's see. Oh, is it possible to put back the test we need to do on your screen so you can save it? Okay, all right. So let me go back. Oh, okay, I'm gonna see my desktop large is. All right, so let's try this again. And here we go. Okay, so all right. Let me scroll down to the tests. Okay, so these are the recommended biomarkers or lab tests that I would require. And these are just the basic ones. There are many others because if someone is menopausal, I would definitely have them add to those tests. So we'd want to know like their total testosterone, their free testosterone, their sex hormone binding globulin, estradiol, because if we need to optimize other areas of their lives, then we would have to do that. All right.
Yeah, all right. Renee, Dr. Clark,
Yeah.
I have a
Yeah.
question here. Somebody just
Yeah.
sent me a WhatsApp message
Okay.
asking if Ozempic can it be used only for diabetes and not for weight loss? The person just
So,
want to use it for just treating just diabetes and not weight loss. Is it
so
okay there?
semaglutide, the molecule is split in two. There is one that is just for people with obesity and one that's just for people with diabetes. So when persons are talking and they say Ozempic, that will always be just FDA approved for diabetics. When persons say semaglutide in the form of Wegovy, that is indicated for weight loss. So Ozempic should not be just used for weight loss because the dosages are very different And the indications for use, that's also different. So I would stick with Wegovy, which is FDA approved for weight loss, because it even goes up to higher doses versus the medication that's indicated for type 2. So tell the person that they need semaglutide in the form of Wegovy. So Wegovy is going to be the brand name. That will require a prescription. And if you're not covered, it is $1,500 to $2,000 a month based on where you get your coverage and if they have a coupon at the time. Our program that we've proposed is $1,605 for everything that I mentioned on that screen for 12 weeks.
Any other questions? Okay, so you're seeing on the screen the test to be done that was requested.
Yes.
So these are the tests. Labs are bookmarked as CBC, CMP or BPM, hemoglobin A1C, lipid panel, thyroid panel, fasting insulin. So these are the tests that you need to do.
Yeah. At least at baseline, because as we are going forward, there can be other things like even a vitamin D as in David level. If you and I were talking and you were mentioning certain things like ongoing fatigue, mental health issues, difficulty losing weight, sluggish metabolism, those are signs of low vitamin D as well. And I'd like to check that for you because low vitamin D is linked to metabolic function or dysfunction. Low vitamin D, depression, anxiety, seasonal affective disorder. Low vitamin D, breast cancer. Low vitamin D, prostate cancer. Optimal levels of vitamin D need to be above 50. But on the scale, you're going to see it say 30 to 100. You don't want to be at 30. It's not giving what it's supposed to. And I didn't mention a lot of that too, Dane, because part of our program, we encourage the use of nutraceuticals. So in tandem with the Western medicine, we do quite a bit of herbal supplements that, once I meet with this person one-to-one, it would be a shared decision-making process with them.
Okay, great. Are there any more questions? We gave a lot of information this evening, and it's a lot to digest, pardon the pun.
Increase satiety.
But I'm really happy that those who were able to join the meeting were informed, and I've been seeing messages coming in that it was quite informative, and they thank
you, guys.
Dr. Clark and the Gateway Pharmacy for providing this information.
Yes.
And just to let you guys know that we continue our sessions like this next month. That's let me bring it up. That will be the 4th of July. That's a very interesting day, especially for you guys in North America. So on that day, we'll be speaking on monitoring and managing high blood pressure. I know a lot of us, we like to do home remedies when it comes to monitoring and treating the high blood pressure. And we don't want to do that. And that is one of the problems that we have, is that we tend to listen to our neighbors. We tend to listen to the person on the street and persons who may have, been treating for high blood pressure, their treatment is tailored for them and not for you. So everybody treatment will be different. All right. So
So,
you don't treat everybody the same way. However, we'll be speaking on that at our next session, which will be coming up. And just to also advertise that um, we'll be doing at Gateway Pharmacy, we are having so many events coming up in the next couple of months. This Sunday, the Manchester Festival Queen will be this Sunday at the Bel Air High School Auditorium. And for the first time, there will be a contestant that wears a sash, Miss Gateway Pharmacy. Quite intelligent young miss, Danisa Green, and we invite you to come and support her. We need to. I think as Jamaicans, we tend to have lost our cultureness, and the JCDC that's the Jamaica Cultural Development Commission. They are driving this process of keeping our cultureness in Jamaica. And at Gateway Pharmacy, we want to partner with them all the time when they're doing such events. So we invite everyone who can hear what I'm saying, or you can share with other friends to come and watch the Festival Queen at the Bel Air High School this Sunday. It starts at 7 p.m. and we invite everyone to be a part of it. And just another advertisement now that the on the 8th of August we also have another patient education session. So you can mark the dates down. So on the 4th of July, we'll be speaking about hypertension. On the 8th of August, we look at heartburns, monitoring that. And on the 31st of August, we'll be having a big party here. So mark the dates down. All right, but you'll hear more. I'm just mentioning it now because we're live, so you can always speak to your friends and mark these dates down. But as time continues, we will give you more information. Again, I just want to thank Dr. Clark for being a part of our first session for this quarter or for this next 6 months. The information that you have given has been quite informative and well received. And based on the messages I'm seeing here, that a lot of persons are telling you thanks for what you have presented. And what I want to say also is that don't just take the information, but use the information. That is more important. It is always good to take the information, but if you don't use that information, then the information you receive didn't really help you at all. All right? So you should always use whatever information you get. All right? So share the information also. Don't keep it to yourself. All right? Don't swallow it and keep it for yourself. Share it with your friends. Share it with your family members. Share it with other persons and let them know what you have learned. And just also let you know that this session was also recorded and it will be available if you want to watch it again. I will have it available on YouTube for you to watch again. All right. If there are no more questions, thank you guys. Thank you for my production team who is here with me, Justice and Everton. We're doing these sessions just live. That's all we're doing right now, just live on YouTube and Zoom. So thank you again, everyone, for being a part of this for us in the series, and you will hear a lot more coming up. Thank you very much. Renee, thank you a lot, Renee. I really, really appreciate it, and I will talk to
yes,
you
that's
later on.
always a pleasure. Thank you. All right. Good night, everybody. Nice to meet you all.